Our customers expect a lot more from our reps and looking for more customized solution. As a result, pharma is investing into learning and development more to equip our reps with the right skill sets. Marketing departments are also adapting to this environment accordingly to produce more customized material for different segments of our customers, providing the right level of information.
Welcome to the Life Sciences Leadership Podcast, where we delve deep into the life sciences industry and uncover effective strategies, innovations, and future trends. Your host, Axtria's Jasmeet Sani, engages highly acclaimed leaders in discussions focused on directing commercial success in the life sciences industry. Whether you're transforming your commercial success strategy or just craving dynamic discussion, this is the show for you.
Hello everyone, I'm your host Jasmeet Sani and welcome to the Life Sciences Leadership Podcast, brought to you by Axtria. Our goal with this show is to bring to you effective strategies, innovations, and most importantly, people who are driving improved business and patient outcomes within the life sciences industry. I'm really looking forward to the conversation today because it touches upon an important and sensitive topic of the field force evolution. We have an amazing leader to share his perspectives. I'm happy to introduce Mehmet Bozbay. Mehmet is currently at Astellas Pharma US, where he leads the field deployment, incentives, and analytics group. He has over 18 years of experience in the pharmaceutical industry and healthcare consulting. Prior to joining Astellas, he was a management consultant and a member of the incentive compensation leadership team. He helped his pharmaceutical clients across a variety of areas, including launch planning, field force design and deployment, alignment, call planning, incentives, and field force effectiveness. Mehmet holds a PhD in industrial engineering and MS in computer sciences from the University of Wisconsin-Madison and a Bachelor of Science in Mathematics from Beloit College. Mehmet, thank you so much for joining us today and welcome to the show.
Thank you, Jasmeet. Glad to be here.
Mehmet, I want to start with strategy. As you know, it is important to determine when and how to deploy the field force since it is a critical component of the pharma marketing strategy. Can you talk about the evolution of the field force strategy and the impact you have seen due to COVID?
Of course. Over the years, there has been a steady progress towards creating agility in deploying the sales forces and being able to respond to changes in the marketplace rapidly. The pandemic, I feel like, acted as a catalyst and expedited the process significantly, especially due to the early predictions on the long-term effects of the pandemic. If you remember, there was a sizable group of experts who predicted the close-to-rep environment to be the norm rather than the exception going forward. As a result, companies increased their efforts towards Customer 360, omni-channel, and slew of other similar concepts during the early months of COVID. In this environment, the need for a well-defined promotion strategy is critical, and the days of non-personal and in-person promotions being in their own strict swim lanes is long gone. A well-thought-out, holistic, non-personal, and personal sales solutions is gaining a lot of importance. It will be critical, in my opinion, for an organization to execute against a precise omni-channel vision.
Mehmet, clearly there has been a deep impact, as you just described, on the way leaders are thinking about the field force. Now, if we were to be in the customer's shoes, specifically HCPs, their behaviors and preferences have been changing even more rapidly. So I would like to understand from the customer standpoint, how have their needs evolved?
Yes, the HCPs are looking for more than just clinical information these days. The days of reach and frequency model very much behind us, where we were able to deliver the same clinical message on a cadence, leading to prescribing behavior based on the recency effect. HCPs want our reps to be more of account managers, connecting the dots with other facets of our organization and bringing customized solutions to them. They want to discuss the mechanism of action burden on patient, formulary-related discussion, all in one visit. So we are trading off frequency with very detailed and informative discussion, which previously used to take place over several interactions.
Right. And Mehmet, this sets up a very good context, both on the customer side and how the pharma leaders need to think. And starting the conversation about how specifically field force deployment and targeting have been impacted during the pandemic. Can you describe the change you have witnessed during the pandemic?
That's actually a great question, Jasmeet. I believe the real impact so far has been the change in discussions during the planning stages of deployment and targeting exercises, but not so much yet in terms of the execution. Early effects of COVID allowed us to question the assumptions we have made historically in these areas. One of the most pronounced rhetoric that COVID created early on was that the majority of the interactions with HCPs would be happening in a virtual setting going forward. As a result, we have started questioning the traditional approach to deployment, territory design, and targeting, which basically assumes that the rep would be responsible for a piece of land and the customers practicing within. And since historically almost all our customers were targeted by the sales forces in an in-person setting, it was important to consider travel constraints in designing the geographies. However, if we assume that the most of the interactions with the customers will happen virtually, it opens the door to locating the reps practically anywhere within the country, hence tapping into much larger talent pool, and also allows us to revisit the capacity assumptions due to the elimination of travel times and possibly reaching more customers during a given day. However, the reality is so far proving to be closer to where we were prior to the pandemic than where we predicted to be as a result. Our data shows that over 90% of the HCP interactions are now happening in person setting. However, one effect that seems to be here to stay is the reduced access, especially in specialty therapeutic areas. The level of activity has plateaued around 80% of pre-pandemic levels on average, and down to almost 60% in oncology.
So, Mehmet, as you described, the customer in general is not content with the traditional field force engagement model, but we are kind of going back to the same traditional model. And there are specific areas that have always seen a contentious battle in terms of adoption, such as call plans. The effectiveness of call plans has always been questioned. In your view, are traditional call plans still relevant in this new world?
Yeah, that's a great question. If anything, the call plans are more relevant than ever in this new world. The marketplace is getting increasingly more complex with the changes in managed care, reimbursement landscape, evolving access preferences, and especially in specialty markets, the importance of the timing of the discussion with the HCPs. There's vast amount of information that is just impractical for a rep to sift through. Hence, providing a well-curated starting point proves even more important these days. However, as I mentioned earlier, we need to evolve from the traditional reach and frequency model to more timely and actionable call plans delivered to our reps, especially in rare disease space, where an HCP might be treating only 1 or 2 patients per year who are indicated to receive our treatments. A quarterly static call plan proves to be almost useless.
That is a very interesting perspective, Mehmet, because most leaders would simply dismiss that call plans are not relevant. But here you're saying the evolution of call plans matters, and the call plans today still are very important, even more important. Now, going back to what we had discussed earlier, the market is rapidly changing and to a large part moving to account-based selling. How are pharma companies adapting to ensure their reps are prepared and qualified to conduct business within the account-based model?
Yes, the role of the sales rep is evolving rapidly. As I mentioned earlier, our customers expect a lot more from our reps and looking for more customized solution. As a result, pharma is investing into learning and development more to equip our reps with the right skill sets. Marketing departments are also adapting to this environment accordingly to produce more customized material for different segments of our customers, providing the right level of information. We are also investing heavily into infrastructure to have the appropriate means, such as Viva Engage, for our reps to interact with the customers virtually. We are enhancing our investment in data to get better understanding of decision makers within the account setting. For example, we are actively exploring lab data providers to understand HCPs that are ordering biomarker tests. Such HCPs will never show up on traditional RX data, but play an important role in defining the treatment paradigm. Similarly, we are looking beyond traditional affiliations data sources and looking at newer sources to understand the intra-account connections to a deeper manner. In short, we are trying to put the customers at the center of our solutioning more going forward.
And that makes a lot of sense, Mehmet. And it is not hard to see that there is a tremendous shift in terms of the selling process and the investment and training required for the reps to get there. Now, if we look downstream, what evolution do you see in incentivizing the field force? Are there specific considerations that must be accounted for?
Yeah, it used to be much more simpler to do incentive compensation when majority of the drugs were in primary care space with vast patient populations, great access to HCPs, and high capture of the sales at the geography level. In that world, setting a goal based on historical trends was a relatively straightforward task. We now have more specialty drugs in the market than ever, with high volatility when it comes to sales at a geography level and less capture of the data at HCP level. In my opinion, there are a few ways that we can deal with this situation. One is to look at the goals at a higher level, such as district or region, to reduce the volatility of the sales data. Of course, as always, there is a trade-off here that we no longer look at the individual performance. We can also lean into MBOs more, where we are evaluating the leading indicators rather than lagging ones, i.e. sales. MBOs, as you know, can be tricky if they are not approached with a very structured and a robust way. The key is to be able to measure them and differentiate the performance across the peers. Obviously, this is easier said than done, and many companies have historically struggled with them. The other challenge when it comes to IC is the ability to attribute the sales to an individual when the data only is available at the GPO level through which the volume is distributed to other member accounts. Having a good process to allow the redistribution of these sales to the individual territories as part of the goal-setting process makes a huge difference.
That is some great advice around incentives, Mehmet. It would be a miss if I didn't touch upon the role of analytics in all of this. In fact, analytics is a key enabler of this rapid evolution. Can you tell our audience how analytics interplays or how it should interplay with field force operations?
Analytics plays an instrumental role in identifying the local opportunities and getting the most out of the deployment. Not only it is important to have the right sophistication when it comes to generating target lists, actionable triggers, and identifying opportunities, but we also need to have the right infrastructure to measure the execution and effectiveness of these offerings, leading to continuous improvement in the quality of the insights being offered to the sales teams. What makes this possible in the first place is to have the right data infrastructure that allows seamless collection, sanitizing, and aggregation of the data.
I love how you see the role of analytics as an integral part of this evolution. Mehmet, in my last question, I want to ask you about the future. Can you tell us what the field force roadmap looks like?
We are really living in exciting times. Although there are many challenges that exist for the field forces, they also present tremendous opportunity for us to shape the future of field operations. I truly believe that the sales reps play a crucial role in the world of omnichannel as the quarterback of the overall execution for our customers. To make this happen, though, there needs to be an organizational buy-in across the board towards a common vision and a clear roadmap, including all key stakeholders.
Remember, that's a great perspective, and the quarterback analogy makes all the sense. Thanks for all those insights. Before we go, I would like to summarize our discussion so the audience has some key takeaways. So, what I understand is one, in the post COVID world, the need for a well rounded promotion strategy is extremely important. Having personal and non personal promotion levers in their own swim lanes can lead to a lot of lost opportunity. Two, the role of a sales rep is more important than ever in an increasingly more complex marketplace. A harmonized deployment approach, incentives, and supporting analytics enable the success of the sales rep of the future. And three, successful implementation of an omni-channel strategy requires alignment and buy-in across the organization. Is there anything else you would like to add to the summary?
I think you have covered it well, Jasmeet. Thanks for having me.
Sure, Mehmet, thanks for sharing your knowledge and expertise in this space. It is fascinating, but more importantly, critical to understand how the field force is evolving and the role it will play in the near future. As you said, the role of a sales rep has become even more important, and an omnichannel strategy driven by analytics plays a key role in ensuring success in the long run. You provided some amazing perspectives that I'm sure our audience will find valuable. Thank you so much for sharing your knowledge and expertise. It has been an absolute pleasure chatting with you.
Thank you, Jasmeet.
To the audience, you are the most important part of the show. The tremendous success that we are seeing is because of you. Thank you so much for joining us today, and tune in soon for the next episode.
Thanks for joining us on the Life Sciences Leadership Podcast. If you loved this episode, please share with friends and subscribe on your favorite streaming platform. For more information, visit lifesciencespodcast.com. Until next time.